Hi all, welcome. We have folks trickling in, and so we'll just give it a few minutes so folks can get situated, and we'll start shortly. Welcome, welcome to those who have joined already. Just as a reminder, we're just giving it a minute or two for folks to get in and get situated. We welcome you to the first launch of our Alameda County monthly child care check-ins, and we'll get started shortly. We should have some funky music for our next session.
That's a good idea.
That is a good idea, especially after a long day. We can sing, just kidding.
I'm sure our providers will be
say.
happy to be like, no, please, I'd rather just silence.
I know I'll do with my voice.
Right?
Alrighty, just one more minute and we'll get started. We have a lot of information, short amount of time. I want to make sure we give you some room to actually do some Q&A during our session today. So we'll get started in just 1 minute. All righty, let's get started. We'll continue to have folks trickle in and get situated. So I want to first welcome you all to our Alameda County monthly child care check-ins. We'll be doing this for the next several months to keep you updated. And this is brought to you by the Alameda County Emergency Child Care Response Team. We've been working diligently on your behalf and want to make information accessible to you. Next slide, please. And so, we'll do the general housekeeping bits. If you are participating in this webinar and speak English, or just speak another language, we have translation available in English, Spanish, and Chinese. You would just go down to the bottom of your screen and click the globe on the bottom to select the language you are most comfortable in. Next slide. Again, if you need translation services, you would just go down to the bottom of the screen, click the globe, and click the language that you would prefer to hear your this session in. Next slide. Additionally, I just want to remind you that the session will be recorded. We know that not everyone can join us in the evenings or on particular days, so this will be recorded and made available to you all. Currently, all attendees are unmuted so that we can kind of smooth out through the presentation. Our chat is currently disabled, but you do have Q&A. Make sure that you populate your questions in there. We will do a live Q&A session later on during this presentation. And that is all for the housekeeping and attendee tools. Next slide, please. Okay, so now that I got that housekeeping stuff out of the way, hello to my fellow ECE champions. Super honored to be in community with you all again. Some of you may remember me. For others, my name is Jennifer Cabán, and I serve with Alameda County Social Services Agency, and I also work with our county's emergency child care response team. So before we dive into content, and today's featured discussion is a vaccinations update. So before we get into that, I just want to make sure that we share with you that this is our first launch of monthly childcare check-ins. You are fully aware at how fast and furious information has come down. We've done some webinars. We want this to be less formal in structure. We want to just make sure that we are sharing information in a timely, consistent manner and answer your questions as quickly as possible in relation to COVID-19 and the ECE landscape in particular. Again, we hope this to be an informal space. You know, we are learning through this process. This is the first, so we're not sure how it's going to go. So please bear with us, but we hope it's timely and it'll be useful as we move forward. We welcome your feedback on what is working for you and what is not. These sessions will run through at least June 2021. And we'll also have translation available in Spanish and Chinese through then. We'll do kind of a test of the waters and see if it's still needed and relevant for you all. But again, we are doing these monthly check-ins first Thursday of every month, 6:30 p.m. To make sure that we have consistent space for you to hear the latest and greatest of what's happening with COVID-19 and ECE. Okay, next slide, please. Okay, so you know that tonight's discussion is on COVID-19 vaccinations. It's our hot topic of the month. Our local R&R agencies, public health, et cetera, have received a ton of questions on it. So we wanted to make sure that we provided you up-to-date information. As you've guessed it, I will be your moderator this evening, and I want to introduce Lisa Erickson, who really needs no introduction. She is, you know her well, and she is our local schools and child care liaison and a super big champion for our kiddos here in Alameda County. So Lisa, thank you for joining us this evening. Please take us away and get us rolling for this evening.
All right, thanks for that nice introduction, and I'm really happy to be here with all of you. Next slide. And I think I have met many of you on some of these webinars. So what I'm going to talk about today, I'm going to just give a very brief overview of what's going on with our cases in Alameda County and our tier status. And then I'm going to talk a little bit about vaccines. And most importantly, we're going to have an open Q&A. So just, you know, getting your questions. I might not be able to answer all your questions tonight. I say this on all the webinars and listening sessions that, you know, I'm not a doctor, but what I can do is when there's questions I'm not able to answer, I am happy to take those back to our clinical team and get answers for you. So, or I can also consult guidance and try to get answers as well. So it's really helpful for me to hear all the questions, even if I can't answer them. Next slide, please. Next slide. Okay, so this is it's not a very pretty looking slide, but it's a slide with lots of numbers on it. And what this is I'm sure everybody has heard this by now, but this is basically what's representing our tier. So it's from the California Blueprint for a Safer Economy. And they have these tiers, right? The purple tier, red tier, orange tier, and yellow. Right now, we're still in the purple tier for this week, but it's highly likely that we will be moving into the red tier by next week. So as you can see, these numbers are looking pretty good. We're at 6.3 cases per 100,000, and those are adjusted cases. And in order to move into the red tier, we need to be between 4 and 7. So we're right there. but we have to be at that, we have to kind of stay at that place for at least 2 weeks before we can move. So this is this week, and then next week will be the second week. And so we should be able to start reopening things by Wednesday if everything goes as planned. Next slide, please. So again, red tier is likely next week, and that means indoor dining, movies, museums, gyms. They all have capacity limits, but there is going to be some more opening potentially next week. This also means that middle and high schools, so all schools can start opening. In the purple tier, it was just elementary schools that were allowed to open, but now middle and high school will also be permitted to open. They don't actually need to have their COVID safety plans approved to reopen in the red tier. All they have to do is develop a COVID safety plan and then post it to their website, and then they can go ahead and open. Next slide, please. All right, so that's just a little, that was a very quick, but I just wanted to give you that update about, what's happening with our tiers. Now I'm going to move into vaccines. So next slide, please. I thought that we would just go through some of the frequently asked questions that we've been getting around vaccines. And then we can obviously answer more at the end of the presentation, but a question that always comes up is children and the vaccine. When will children be able to get vaccinated? Can they get vaccinated? So right now, only ages 16 and over are authorized to receive the Pfizer vaccine, and then 18 and over for the Moderna vaccine. Right now, there are clinical trials happening for children. So hopefully the vaccine for children will come soon, but we don't know exactly when that might be. But probably, I'm assuming it wouldn't happen, anytime really soon, maybe sometime next year, but we don't know for sure. Next slide, please. And we also get lots of questions about timing because the two vaccines that are available, mostly available right now, now there's the new vaccine that's coming in, that's a 1-dose vaccine, the Johnson & Johnson vaccine. But for the Pfizer vaccine and the Moderna vaccine, the Pfizer should be 21 days apart. So you get your first dose, and then 21 days later, you would get your second dose. And then for Moderna, it would be 28 days apart. So it's a 2-dose vaccine. Next slide, please. So is it okay to receive that vaccine, your second dose, a little early? What they say is that for both vaccines, the vaccine can be, your second dose can be administered 4 days before the recommended date. So you can get it if it's 17 days, so it'd be 17 days and then 24 days for 17 days for Pfizer and then 24 days for Moderna. Next slide, please. This one is for, can you get your second dose late? And so this would be the second dose for the Pfizer or Moderna may be administered for up to 6 weeks or 42 days after the first dose. And so we don't know how well the vaccines will work if the second dose is administered after 6 weeks, but we do know that the 6 weeks is okay for the second dose. All right. Next slide, please. Another question that we get a lot is, should I get the vaccine after having COVID? Yes, you should get the vaccine even after having been COVID positive. However, you obviously don't want to get the vaccine when you're home isolating, when you're sick with COVID, and you might consider waiting 90 days until you get the vaccine, because there's not a lot of supply out there right now, and your immunity, the immunity ranges between individual people, but the immunity, typically lasts for about 90 days after having COVID. So you have a little bit of time before you might need to get that vaccination. And then also, if you were treated with monoclonal antibodies or the convalescent plasma, you should wait at least 90 days before getting that vaccine. And obviously talk to your doctor if that was something that you had COVID. Next slide, please. And now slowly, the CDC, as well as the California Department of Health, is beginning to release post-vaccine guidance, which means I've had the vaccine, now what do I do? What can I do? What can't I do? How is this going to change my life and everything around us, right? So the vaccine will protect you from developing severe illness, but it may not stop you from spreading COVID-19 to others. Okay, we're still learning a lot about the vaccine and transmission, but we're not, we're not positive that you won't be able to spread it to others. So they want you to still be safe. Also, there's variants, and they're not super clear about how the vaccine will be protecting us against all these different variants. And until we get enough people vaccinated to protect our entire community, it's critical that, even those who have been vaccinated continue to wear masks and follow other COVID prevention guidance. So for now, most of the, the mitigation, the safety strategies we've been doing, we're going to continue to do, except for the exception of a couple that I'm going to talk about. Next slide, please. And this is just a nice slide that shows, even if you get the vaccine, you can still transmit COVID. So keep doing your part. Next slide, please. Let's see. Okay, so what is this slide on? I have to remember what I put in this slide. Oh, yes. Okay, so this is post-vaccine quarantine guidance. And if everyone remembers what quarantine is, that's after you've been exposed to someone with COVID-19, right? So after you've been exposed, you usually have to quarantine from between 10 and 14 days. But the California Department of Public Health put out this new vaccine quarantine guidance that's also based on the CDC guidance that says that once you've been fully vaccinated, okay, that means it's been 2 weeks after your second dose, and it's within that 90-day window, okay? So it's 2 weeks after the second dose, and it's within 3 months following that last dose of your series, of the vaccine series. You would not need to quarantine after being exposed to someone who was positive. Hopefully that's clear. And also, if you just continue to not have symptoms, if you've been exposed to someone and you just don't have symptoms, then you would not need to quarantine. If you develop symptoms, then you would need to talk to your doctor and potentially isolate. So that's the one thing that has changed as a result of getting vaccine. Next slide, please.
Lisa,
yeah.
I have a question. At what age do children need to get tested for COVID-19?
Oh, testing. Weren't even talking about testing tonight. I believe that children, that's a good question. I believe they can get tested at any age, I want to say. I'm not sure that there's an age that you can't. I think it's any age as far as I know. Yeah, but I can definitely double check on that.
Thank you.
It's funny, I've gotten so used to all the vaccine questions, I forget about the testing questions.
Thanks.
Thanks. Next slide, please. So now into kind of what vaccines are looking like in Alameda County, the vaccine rollout. Next slide, please. So this is a slide that talks about all the different ways that vaccines are being distributed in our county. As you can see, it's pretty diverse, lots of different places where folks are getting vaccines. This is the entire strategy. So up top, you can see what we call pods in that blue square there. That stands for point of distribution. So vaccine point of distributions or vaccine pods. And I'm sure many of you have already heard about a lot of these places, but we have pods, which that's like the Alameda County Fairgrounds, as well as the Oakland Coliseum. And it looks like the Buchanan parking lot in Berkeley as well. And then for the community pods, we have Oakland High or Fremont High in Oakland, and that's serving the East Oakland community and the surrounding kind of neighborhoods. And then we're also planning to have more community pods coming on board, hopefully in the next month or so. And those will be in some of the neighborhoods I'm going to talk about in a bit. And then we also work with our healthcare partners. So we have the community health centers like Roots and Davis Street. And then we also work with hospitals, some of the large medical groups, pharmacies, and not sure about the for-profit vaccinators. I'm not super familiar with that, but I guess they're under consideration as well. Next slide, please. So right now, as you know, we prioritize vaccination. We don't have enough supply right now. We're still needing more vaccine in order to vaccinate the entire population. So because of that, we have to prioritize. So right now, we're still continuing to vaccinate healthcare workers and people in long-term care facilities, people over 65 and over, food, agricultural, restaurant, and grocery store workers, as well as emergency service workers, and of course, education and childcare workers. And within each category, we're prioritizing older adults, the medical or uninsured, areas with very high COVID case rates. And I'm going to talk a little bit more about those neighborhoods. And then people with direct contact, so people like you all who are actually out there working with the public, working with children, they're out in the communities. We really want to prioritize all of you, those people that can't work from home. And then lastly, people with limited mobility. Next slide, please. And then this is just a little bit about who's eligible in each sector. I won't go into too much detail, but for education and childcare, you should know that all formal and informal childcare workers, including daycare providers, are eligible, as well as colleges, universities, and then all of the educational support services and administration. This also includes all the support around childcare, right? So you have quality coaches that might come out to your programs, or nurses that come to your programs. All of those people, or people that give you supplies, they're also eligible to be vaccinated. So the entire infrastructure that supports childcare. Next slide, please.
Lisa.
Yeah.
Another question regarding the time. So someone received their vaccine at the Fremont High School location and received a link for their second vaccine. It's Moderna, but it's only 21 days after the first dose, and they have no contact number. Is this a concern? Is there something they should do?
Okay, and what did I just said it was supposed to be? I have to go back to that slide.
24. You said 24. Mm-hmm.
Okay, and then sorry, can we go back to the slide that it was like the earliest, or can follow up at the end? But sure. I just want to make sure I'm reading the slide correctly.
Okay, we'll answer later. Thanks.
Then we could just go back if that's okay.
Oh, okay.
Okay, great. So these are the neighborhoods that have the highest impact of COVID. You can see down here below. And it's San Antonio, Fruitvale, East Oakland, Ashland, Cherryland, South Hayward, and West Oakland. So these are going to be the places that we're going to be targeting, getting the vaccine to these folks. We're going to be doing a lot of our targeted outreach in these neighborhoods. And we also want to develop community pods in these places, right? We want places that are accessible, that anyone can go to get their vaccine. Next slide, please. And this is just a little update on all the doses that we've been giving out. So let's see, at the Oakland Coliseum, it's 6,000 doses a day, which is, and then 85% is drive up, 15% pedestrian. And then there's also these mobile units that have been going around to different places. This mobile unit was actually at the Alameda County Office of Education a couple weeks ago. And it's been focusing on faith-based places, churches, and now it's going to be at the Native American Health Center in the East Pont Mall Town Center this week. Next slide, please. And then this is I love this picture of the fairgrounds. This is actually the site where I volunteered a couple weeks ago. It actually ran really smoothly when I was there. And so far over 5,300 vaccines total, and we've vaccinated over 3,080 in our county, which is exciting. And let's see, and we anticipate over 12,000 doses total. So 1,000 county plans over 6,000, 1,000 a day. All right, next slide, please. And then these are just pictures of the community pod. This is the Fremont High School pod. And we're going to, like I mentioned, we're going to be doing more of these in other communities. Next slide, please. And then lastly, these are all the links for how you might be registered or find out about, how to get appointments at these different sites. The Coliseum is My Turn, which is that first. hopefully all of you are receiving updates from your resource and referral agencies. This is the most important thing to remember for childcare. We're partnering really close with this childcare team that's on this call tonight and all of the resource and referral agencies. So we're really relying on the resource, on the R&Rs. And we're really thankful for the R&Rs to be able to get this information out to childcare providers. So they've been sending out the invites. They're going directly to, family childcare homes as well as to childcare centers. If the childcare center receives that invite should go out to all of your staff. But yeah, the goal is to have, all of the childcare vaccinated over the next couple of months. So this is just a list of all the different links and ways that you can sign up to get vaccinated. And let's see, next slide, please. I think, yeah, and then here's some more information about the healthcare centers. And lastly, it's the pharmacies. But the big ones are My Turn, which is the Coliseum. And then for all of our county pods, that's by invitation only. And you should be receiving those invites through the resource referral agencies. Next slide. Oh, and then the state update, they're going to be expanding their eligibility for vaccine, which will be starting next week on March 15th. And so they'll be starting to prioritize vaccinating people with underlying medical conditions. There's a list of those here. I won't read them all out. And if you have high risk of disability or one or more of the following applies. Individuals likely to develop severe or life-threatening illness or death from COVID, or acquiring COVID will limit the individual's ability to receive ongoing care or services, and providing adequate and timely COVID care would be particularly challenging due to that individual's disability. So that's going to be a whole nother group of folks that we're going to be able to vaccinate starting next week. Next slide, please. And lastly, just everyone, we're trying to just get this message out. And I think this would be a good little poster or something to have at your childcare programs, I think. As I was putting the slides together, I was thinking this would be like a nice thing to have on your door. But we're calling these the 5 W's. So wear a mask, wash your hands, watch your distance, wait to see loved ones, and when it's your turn, get vaccinated. And I think that's it. So before we get into questions, can we go back to that slide, Jen? Do you mind on the early? I think it was the early question, right, Neva? Around how early is it? I just want to make sure that I don't mess that question up.
That's correct.
Okay, thanks. And there they are, 14. There you go. So can I receive my second dose of vaccine early? So you said it was the Moderna vaccine?
Correct.
Yeah,
and it was only 21 days?
Yeah.
The second appointment, that's probably not ideal, because it says it says 24 days here.
Yes.
Yeah. So let's see. I'm trying to think.
So both vaccines can be administered 4 days before the recommended date. So if it's 21 and 24, that's 3 days. So that should be all right. Correct?
I guess I didn't understand the question.
I'm sorry.
Can you repeat it again, Eva? It's okay.
So she received her first vaccine, and then she got a link for her second Moderna dose, but it's only 21 days after her first dose.
Oh, and this one says, yeah, it shouldn't be, yeah. So 24 days is the least amount, if that makes sense. So 21 is probably too little. It's too soon, based on this.
But look at the first bullet point. Both vaccines can be administered 4 days before the recommended date for
but the recommended date is
24.
No, go to the recommended date. Jen, sorry, the slide before this one.
Sorry, I'm getting confused.
Yeah, I know. It's the way the slide.
28.
Yeah, see, so it's 28 days. The recommended is 28. 24 is the least amount, right? And so if it's 21, that's too little of time.
So what should you recommend if she has no phone number to contact someone about it?
Yeah, so that's a good question. How to get I do know that they're doing walk-up appointments at the Fremont pod. So I might recommend going to the Fremont pod. That's one. I mean, you can call 211. I think that's another way, is to get a different appointment. So I would call 211. Sometimes it takes a while to get through to 211, but keep trying. And if you aren't able to, you can go to the, I would do, 28 days, or, you could go even the day that you had that appointment and just tell them that it's not the right appointment and that you need to get another appointment. But hopefully 211 will work if you call 211 to reschedule your appointment.
Thank you.
Yeah. Was that clear? Okay.
Yes.
Okay, great.
And those are the only questions we have right now.
Oh.
So
Oh, that's just
this is a great time, providers, if you have pressing questions about accessing vaccinations or information related to it. We have this candid time with Lisa to get these questions answered, or at least for her to go back and get them answered so that we can share those with you all. So feel free to populate that in the Q&A box down below. And I will just reiterate while we're holding on that, that again, make sure that you are connected to your local resource and referral agency. We, as part of the Alameda County Emergency Child Care Response Team, are using those agencies as our communications portal. So like electronically, we know that it's not always the best and ideal place to do, but it's one that is consistent. And so, you'll get consistent messaging across. We on the response team are working to make sure that that language is the same across the board. So you're not hearing one thing from one agency and another thing from another. I don't see any questions listed down below. So there are some resources that I want to share with you, and maybe that'll come up for you. So this first resource, that the state has provided some additional rounds of funding, COVID-19 specific relief funding for small businesses. There have been 2 rounds already that have passed. They've added a 3rd and a 4th round in total. Again, the grant size are up to $25,000. Next slide. And so here's some key information for you to note. The website to get information about it is on top at careliefgrant.com. And here's the information that you should know and is relevant to you. If you've applied for round 1 or round 2 and were waitlisted, you will be available. Well, they will look at you as a potential for funding for this particular round. Unfortunately, there are no new applications that will be shared or available for you to apply for in round 3. So just know if you've applied round 1, round 2, and didn't get funding availability, they will be targeting those small businesses during that particular period of time. That window is tomorrow until next Thursday, the 11th. So keep your eyes peeled on your emails if you were waitlisted for funding opportunities. Round 4 is technically not available to child care providers. They are targeting nonprofit cultural institutions. So I'm noting it here just so that you have the information, because there are 4 rounds. But this is not applicable to child care providers at this particular moment in time. Next slide.
Jen, we do.
But please share.
Go
ahead.
We do have some questions when you're ready.
Okay, we can pause because this is totally different. Go for it.
All right. So one of the questions is, we have parents who want it to be mandatory for our teachers to get vaccinated, and they want us to let them know that the teachers are vaccinated. I'm assuming this is not possible, correct?
That's a good question. The vaccines are not required. And it seems like a privacy issue to be, I'm not an expert at, HIPAA and FERPA and all those legal, everything legal around that, but it seems like it would be a privacy issue to disclose that kind of, personal health information to the families.
Thank you. The next question is, what is the recommended age for children to receive the vaccine?
Yeah, so as I mentioned in the previous slide, for the Pfizer vaccine, it's 16 and over, and for the Moderna vaccine, it's 18 and over. And right now they're doing clinical trials for children, so there isn't a vaccine ready for younger children at this time.
Great. The next question is, how do adults in general get their shots?
Yeah, that's a good question. I think that we need more supply first before we're going to start to be able to prioritize. So what the state has said is after we move through these priority populations, they will eventually go back to kind of an age distribution process. So I'm assuming that will be, we do all these priority groups, and then maybe it would be kind of like ages, 65 to 55 or something, then that would be the next cohort. But I don't know for sure how that's going to work. I also think hopefully some of the healthcare providers will get more vaccine as well. So perhaps the general population, when there's more vaccine, maybe we can get it through Kaiser and places like that when they just have more of it.
Thank you. Then there's two more questions. Until when will we need to maintain stable cohorts?
Yeah, that's a good question. I have not heard that the state is planning to change that guidance anytime soon. I'm assuming that the stable cohorts will remain probably through the summer at least. That's what I'm thinking, but since we're having these monthly calls, I mean, obviously if we hear anything, if anything changes, we will let you know. But yeah, we haven't heard anything about that cohort guidance changing.
Thank you. And then there's actually two more. What if I'm a family childcare provider? Can my family also in my home while I'm caring for kids get vaccinated?
Yeah, that's a really good question. The people who can get vaccinated would be those that are on your license or, part of your business, but it can't be everyone in your family. It's just those that are, part of your business.
Thank you. We have a question on your first slide. It said that cases per 100,000 were adjusted. Adjusted for what?
Oh gosh, you're gonna. That's one of those questions. Okay, so I can try to explain it. I'm not an expert at all this data, but what they do, if we can go back to that first slide, and I can show you while I'm explaining if you want. I can want to go back, Jen, but they adjust it because it's based on testing. So if we do a lot of testing in our county, they'll adjust the case rate based on how much testing is happening. So if there's very little testing, maybe your case won't adjust as much. That's my understanding, but that's about all I know. I don't know exactly, the logic. It's based on how much testing is happening.
Okay, and then this may be for you, Jen. Is the California or someone else, is the California Relief Grant prioritizing childcare providers who are not working with subsidies and therefore not receiving stipends, nor the first 5 grant?
So I would just note the first 5 grants, the one made through First 5 and through Alameda County Social Services Agency, that was with local funding. And so that is very separate from the California State Relief Grant. Eligibility is on the website. It's not just for childcare providers, it's targeted to small business. And so they ask for things of fiscal information and the such related to the application. So on the website, Rowena, if you can take us back to the ECE program, there's additional information. So there's not a specific target for any type of business and small business. The state has established their own guidelines for that. It's just that childcare providers, whether they receive subsidies or not and have not received, other COVID funding, would be eligible. So that's one piece, and I would be remiss, there was additional, 2 additional rounds. But round 5 would be for those who are not funded in round 1, 2, or 3. And then round 6 does not have a date announced with it. So we'll be sure to provide additional information once that comes available with the state. And then I would also note for you, sorry, if you can 2 more slides to the ECE program. Oh, no, back one, there. I told you we're learning as we go. So the ones there we go. So this particular website is also going to be a helpful resource for you. This is going to be, we're sending out email communications through our resource and referral agencies, but also we have a COVID-19 vaccine information, and there are other resources outside of just the vaccination piece that is consistent and aligned with local and state and federal guidance. There are some human resources components available there. I have noted the acgov.org /ECE or / I should say ECE. There's a link there that you look for reopening childcare. The link for this actual page is just super long and didn't want to bombard you with that. So go to the ECE program website and you will have access to all the information shared here, but also guidance for funding and just the vaccination stuff. So please go there for centralized information.
Great. We have 2 more questions. One is it safe to get the vaccine if you are pregnant?
Oh, that's a really good question. I want to make sure that I have the right answer for that. So I'm going to actually ask my clinician. I believe it is, but I don't want to tell you that. And then, so I'm gonna ask Dr. Burling about that and get back to you.
Okay, great. And then with schools ready to open, what will be the social bubble cohort size? Is it going to change?
Okay. So with schools opening, this is a little bit of a complex question. I want to make sure I understand it. So the school reopening guidance is a little bit different than the cohort guidance. So opening, they do not have to follow the cohort size guidance. So their classrooms, they have to follow distancing guidance, but not cohort guidance. So for an example, they could have, 16 kids in a classroom as long as they were between, around 4 and 6 feet apart. So yeah, but regardless of schools opening, childcare and camps and most other child and youth settings will need to follow that cohort guidance, which is the 14 kids and the 2 adults.
Thank you. And then I did see a question as to whether Jen just answered it, whether the slide deck would be available. Oh, more questions are coming in. Okay, do you know how to use PayPal to apply for PPP?
I don't.
I don't either.
Yeah.
Yeah, that's not not something that I'm aware of. There is a resource, I believe it's maybe the Child Care Law Center, if I'm not mistaken, that has some information related to the loan process that might be helpful. So I will try to get that website to share with you all.
Great. And then we have parents want to travel. Do they need to stay home 10 days after they return back to their residence or county from their vacations?
Yeah, that's a good question. So I'm going to share our link, our local travel guidance. I can share that in the chat. Right now, and we're also following the state guidance, it's recommended that people quarantine after travel. It's not a requirement, but it still is in place. There has been some, I should mention too, that the CDC, I believe right now is starting to, they're going to be releasing some post-vaccine guidance. That might have a little bit of a change to the travel guidance after you've received a vaccine. maybe that will come out tomorrow. People are thinking that maybe this new post-vaccine guidance from the CDC might come out soon. But as of right now, the travel guidance is the same. It's recommended to quarantine after travel. And I'm going to go ahead and just find that link for you and put it in. Is it in the chat, or how will we share the link?
Maybe in the Q&A.
Can I put it in the Q&A? Okay. I could do that.
You can put it in the chat, Lisa.
Oh, I can. Okay, great. Thanks. I'm just going to do that real quick. You can keep asking, Neva, while I do this if you want.
All the questions that I have right now.
Oh, okay.
Okay, there is one more slide that I want to make sure we share with everyone. So next page. And so, you know, this is a repeat situation, and I'm sorry to bombard you with the same message, but your local resource and referral agencies are your connection to real-time information. We are working with the response team, healthcare services agency, public health, to get the consistent messaging out to you all. That is the best medium that we have that is expedited. So please make sure that you are connected. The information for each of the RNRs is located on your screen. Make sure you get their, you know, get on their listserv and that they have your information. I know not every, you know, while they're a great resource, not every childcare provider is connected to them. So, you know, please, for this COVID messaging piece, get connected to your resource and referral agency if you haven't. They've also helped with community supplies disbursements and just getting access to a ton of things. Super huge resource. Stay connected and get connected to them. Are there other questions?
Yes, there's one more question. We can write in our school policy that they have to quarantine for 10 days, correct?
Yes, of course. You can always be more restrictive than our policy. You know, we can recommend it, and you could actually take that language out of the link that I just shared and make that your policy if you want. That's definitely fine.
And that is all I see.
Okay, so can we go to the next slide? We just have 12 minutes. Again, we wanted this to be as interactive as possible, give you some real-time information. If you have specific topics that you would really like to see covered, please connect with us and get us that information, and we'll make sure that it's relevant. We don't have the chosen topic for our April 1st meeting at 6:30 p.m. This question came up earlier in the Q&A component. We are hoping to get you a consistent link so you don't have to always register, but that might be the reality moving forward. Again, we're learning and figuring it out, but this will be monthly and time-sensitive information that we want to share with you here. And again, we will have these recorded and available for you to view at a later time if you just don't have the capacity to do so on the first Thursday of every month. Just want to make sure. Oh, there's a few more questions.
3 more now. I wanted to let you finish, Jen. How do we get a vaccine and make an appointment with Kaiser? That's one question.
Okay. Super familiar with, I'm actually a Kaiser member, but I'm not familiar with how to get a vaccine through Kaiser. I believe in the resource that we share, there is a link in there to Kaiser, but I'm not for sure. I'm not real clear on the specifics because they've only recently been serving educators, right? They were 75 and over for many months or a couple months. And then there were 65. And I think they just very recently started to serve educators. And I'm not exactly sure how they're doing that yet.
I can say that they sent me a link. So generated from them when it was my turn. Not from my turn, but from Kaiser. Yeah. So that's how it worked, that they're monitoring their own patients for their opportunities.
And I will also just share that I've tried to just go through, they do have a questionnaire that you would fill out, like, you know, are you this, are you that, and the such, and then it tells you we're currently not at your group yet, and we have your information. We will touch base with you once you are eligible. And you can always talk to your doctor about that. Again, like every resource, we know that it's disjointed. You have FEMA state-run sites, you have county-run sites, you have hospitals running sites, and it's a bit challenging to do, but ask questions wherever you are, and until you get what it is that you're looking for.
And we have some more questions. I'm at a preschool. Do we need to change the children's shoes when they come in to the school? Also, some of our kids are having a hard time wearing masks. Do we need to make them wear them?
Yeah. So no, you do not need to change shoes. That question's come up quite a few times actually over the past year, but no, that's not part of the guidance. And strong encouragement to wear masks. Little kids, it's going to be challenging sometimes, but all we can do is just continue to encourage them and try to get them to wear the masks.
Thank you. And then there's a question about as you show to us online. I think maybe can you show us online, but I'm not quite sure. And then there's can you email your doctor? So those are two questions. And the final question is just a comment that this person got an appointment with Kaiser by telling them that they work in childcare.
Oh, that's great. Glad to hear it.
While we're going down the questions, I will just look up to see if I can find the page where they had those screener questions for Kaiser.
Thanks, Jen. I should start including that in the presentation. It was a very recent development.
And then there is a question about, as a provider, do you have the right to have your own policy regarding COVID-19?
Maybe more specific around which policy?
So I would say you have to keep within the guidelines, but if you want to extend it or make it mandated, the other person had spoke about 10 days, that seems reasonable, but yeah, we would need more detail, I think.
Yeah.
So I'm hearing some human resource related questions come up. That's a little challenging, but we'll see if we can get someone to come in to answer more specifics. We just know that with the vaccination, it can't be forced for an employer to make that mandatory for their staff at this particular moment in time. But I see that there's questions, so I'll note that and see if we can find additional resources for you.
Okay, and then let me see if there's other questions that we need Lisa to answer. Let's see, post-vaccine, is the vaccine good for more than 3 months?
That's a good question. I think they're still doing research around how long the vaccine kind of immunity might last. 3 months for sure, but I think there's, really just learning more around how long it could last and what might be needed in the future, if there's going to be booster shots that might be needed, or will the 2 doses or the 1 dose be enough, for longer than, multiple years. And I don't think we know yet. We know 3 months at this point, but it could be longer.
Thank you. And then Jen, I think this is for you. I temporarily closed the childcare center in December last year and plan to restart it in April this year. Is this situation eligible to apply for PPP?
I don't have that answer immediately. I was on the SBA site to check eligibility. It's for those, I know it's for small businesses that have been impacted by COVID-19. I don't know if it covers closures. It might, but don't have that information. So hopefully I can share tonight, but if not, again, that's related to kind of like the business HR admin side. And so we'll work on that.
Okay. And then what way is the easiest way to get the vaccine for a daycare worker?
That's a good question. I want to say, like we've been saying, is be in touch, make sure you're getting those emails from your resource and referral agency, because we're really, the Alameda County Public Health Department is really trying our hardest to target childcare providers and get that information out to childcare providers. And we're doing it through the resource and referral agencies. So I know that we're sending out these invite links, and just be sure to check your email. And I think hopefully that's a reliable way. I think it's a reliable way to get an invite. And I know we have appointments coming up at the fairgrounds. Will be kind of a weekly new appointments every week at the fairground site. So I would say continue to check your emails for those invite links.
Great. Oh, is it recommended in the guidelines to quarantine for 10 days if you travel 120 miles from your residence?
Yeah, I can actually open up can I open up that link and we can just read it really quick? Is that possible? That I've shared? It might just be good just to look at it because it says it right in there.
I think so. Let me, yeah.
If it's not, don't worry.
You should.
I can just read off of it if you want.
Okay.
If that works, hold on.
Yeah, I was gonna say you could share your screen, Lisa.
Oh, I can. Okay.
Yep.
Great. I'll do that.
And while you're looking for that,
Okay.
another
There it is.
one.
Okay. There it is. So if you traveled more than 120 miles from your home and spent time with people you normally do not live with, you can reduce the chance of spreading COVID to others by doing the following. You should, in most cases, stay home for 10 days after the date you return. And then there's the California Department of Public Health's travel advisory. And then we also recommend we say consider getting tested 3 to 7 days after returning from travel. So 10 days after traveling more than 120 miles.
And there's some more questions coming in.
Okay.
Let's see. Do we need to wipe down our playground or play structures between each cohort using it?
Yeah, that's a really good question. And okay, this is what I'm going to say. In the updated K through 12 guidance, they actually said, no, you do not need to do that anymore. You just need to clean, you don't have to wipe down playgrounds. You just have to make sure that the students wash their hands after using the playground structure, but you don't need to wipe it down in between using it. Unfortunately, the California Department of Public Health hasn't updated the childcare guidance yet. It hasn't been updated for a while. But I'm going to assume that that's, it's kids using the playground, and it probably applies to childcare as well. And we're really trying to pressure the state to update the childcare guidance to be more in line with the recently updated school guidance. So hopefully that answers your question. So make sure that the kids wash their hands after using the playground. But I'm going to assume it's similar to K-12, and you don't need to, clean it after every time.
Maybe have them wash it before and after.
Yeah, exactly. Which I think that's like part of the, what you do in childcare anyway, right?
And then there's a follow-up from the question regarding policy. And what she meant was, can she request a COVID test 4 days before they return back to school if they've traveled or were infected with the virus? And then could they close for 15 days instead of 10 days? And in the same line, after how many days can I clean if the school has been exposed to COVID? And when is it safe to clean after the exposure?
Okay, so the first question is around the travel. So I think what the question is can you make that the travel guidance I just read, right? Can you make that your policy? Which, yes, I believe you can. So you could put that into your policy if I'm understanding that question correctly. And then the other question is, how long do you have to wait to clean after a positive case, right?
Yes, that's a good-
Yeah, that's a good question. I don't think, yeah, I guess the trick is you want to make sure that space was ventilated. You want to make sure the windows are open and, you know, the space has been well ventilated. And then I think you can go in and clean the space. But yeah.
And do they have the right to close for a longer period of time, 10 instead of 10 days, 15 days if there's been exposure?
A case. Yeah. I mean, I think you have the right to close as long as you want. I mean, that's your right. I think the tricky part, and I'm not an expert at the funding mechanism, but I think if you're a state funded, there's certain, you know, to get reimbursement, I think I've definitely gotten lots of calls around that, you know, that it needs to be kind of within that public health guidance timeframe. Otherwise, you might not get reimbursement. But I think if it's your privately funded program, you can close, yeah, for as long as you want.
Okay, so we're at time, so maybe we can do one more question. The question related to PPP, I put in the chat, so please take a look at that. It doesn't exclude you if you've been closed, just related expenses. So Neva, share one more question and then we'll close out for this evening.
Okay, the main question is, could you send the information and link to everyone who attended after this session? And so that's just a health question though, is what about a family member of a child who has traveled?
Wait, so the family member traveled and the child did not? Or the child traveled and I'm confused.
I think it's a family member has traveled, but the child has not.
Yeah, that the child does not need to quarantine.
Okay.
Yeah.
And then, well, I know we know the answer. It's just very quick. When will schools be reopened? And that really depends upon them submitting their plans and having the plans approved, correct, Lisa?
Yeah, I mean, actually in the red tier, they don't need to have their plans approved. I think it just depends. It's district by district, school by school, and what their plans are. It varies a lot. Some districts like Piedmont is already open. I think Pleasanton may be open this week. It's kind of all over the map. Okay. Some schools, I know in Hayward, they've decided that they're going to do distance learning all the way through the school year. So it's kind of
local decision.
It's a local decision for sure.
Okay. And that's it.
All right. Well, we're close to on time. I'm a proponent of honoring people's time and the hour. So thank you all for joining us this evening. I hope this was super useful to you. Again, if there's any recommendations on topics, please let us know so that we can get that for you in our next session. We thank you. You have a good evening. Stay safe, stay healthy, and we look forward to seeing you next month. See you all.
Thanks, everybody. Have a good night.
Buenas noches.
Bye.